And here on the executive stage, we have the Systems Architect Manifesto and the author of the book, Carlos Frederico Pinto, and he's back here with Paloma. So guys, I will leave the stage with you.
Thank you. Hi, I'm Paloma from Lean Institute Brazil. Dr. Freddy is a medical oncologist and healthcare administrator. He's currently consultant and senior advisor of the Lean Institute Brazil, chair for the International Quality Steering Group, member of the Care Deliverable Committee for the American Society of Clinical Oncology, ASCO, and faculty for the Institute for Healthcare Improvement. His experience includes leading the Instituto de Oncologia do Vale, IOV, Lean Journey for more than 2 decades, as well as leading cancer institutes, programs, and general and emergency hospitals. He's also author of the books In Search of the Perfect Care, 2014, and System Architect Manifesto, 2024, both published by Lean Institute Brazil. It's a pleasure to stay here with you, Dr. Fred, to learn more about the System Architect Manifesto. Thank you very much.
Thank you, Paloma. Thank you for a kind introduction. I will share my screen now. Can you see my presentation now? Yeah, it works? Yeah, good. So I'm talking about the Systems Architect Manifesto. I spent more than 2 decades leading IOV, a cancer organization, and we were responsible for cancer treatment for almost 2 million inhabitants in our metropolitan area. And we published this experience 10 years ago in the book, In the Search of the Perfect Care. But almost at the same time, 10 years ago, we figured out that we got a problem. Well, what was our problem? The problem is because individual or team performance are deeply affected by the system. And this effect can impact on performance in a way that we cannot sometimes predict, because complex systems, they are not defined by nature, they are defined by behavior. And organizations develop some kind of behaviors by themselves that sometimes are not expected or not a good interaction. So we would love to have more coherent behavior in our organization instead of chaotic behavior. So we want more people working more organized than working like crowds, and working in different hospitals and emergency departments all around my area. Several organizations, the work is like working in crowds. So we need to get more coherent, and we learned something about it. We learned that communication is everything about systems. All complex systems have robust communication systems, sometimes invisible. And any organization that is designing a system will inevitably produce a design whose structure is a copy of the communication structure of the organization. So this is a very challenging situation when we are talking about people. So 10 years ago, we started working with our leaders, changing the way they behave and trying to get better ways to communicate and to create a structure that, in fact, sustain the structure that was there by better communication. So my manifesto, the manifesto contains 7 statements. It's a simple message. It's a small book, but I will not follow the order of the book. But the idea behind the manifesto is approach how we can affect systems using the concepts behind Dr. Deming's system of profound knowledge. So what we are doing is thinking about the system of profound knowledge and creating some approaches to deal with daily basis challenges. So the first statement is that if you don't understand your system and how your system behaves, you're being controlled by your system. And the second goes about communication. Actually, it's not the second, but this is the order that we choose today. So the way people communicate determines how the system works. And dysfunctional communication creates dysfunctional system. And a dysfunctional systems behaves like crowds. So the problem of communication go a little bit deeper because, well, communication has some challenges because 7% of people understand is about what is said. 55% of is about what we see. It's visual. The way we behave, the nonverbal communication is responsible for 55% of what we get. So gestures, posture, reactions, the way we look, the way we just smile, minimal details can change the behavior of our organization. And 38% is the tone of your voice, how we talk, if we are persuasive, if we are emotional, if we are enthusiastic, or just boring. So communication is a real challenge, and it gets even worse when you think about several channels of communication inside a large organization, when you can go from 3 persons to 12 persons or more and have innumerous several lines of communication and several different messages that can be expressed throughout the system. So this creates a huge amount of variation in the system, and a huge amount of variation means that you have a lot of problems, because variation can induce errors and defects. It creates breakdowns and delays and obviously inefficiencies. But the point is that it's an infinite loop. It's a downward spiral. Errors, inefficiencies, and breakdowns creates more variation, and you got a loop. So the other statement is about variation. Variation in the system increases complexity, errors, delays, and efficiencies. The less variation you got, the fewer defects, fewer problems. So dealing with variation is dealing with complexity. And we use those basic tools to deal with 2 dimensions of complexity. We can go deeper on several dimensions, but we can use just value stream mapping to manage fail and variation in processes. And this obviously reduces complexity. But the complexity of human interaction is a big challenge that cannot be solved by common sense. It's not enough response to deal with complex problems. So we have to go to the real world to see what is happening and understand about what the complexity of communication is trying to tell us. Because simplicity is more attractive to our minds and to our hearts. So we don't like complexity. Simplicity provides us a welcoming and inviting environment against complexity. And problems emerge not because too much complexity or too little complexity. They arise from the incompatibility between complexity of the task and the system that executes the task, or just you and me. We are executing some tasks that are far beyond our reach, or there are too many variables involved, or we are not well trained or prepared to do. So that's complexity, when complexity arises. And unfortunately, perceived complexity induces paralysis. So this is an emotional response to uncertainty. We get frightened about what we don't know. This is a response that is an instinctive reaction. It's a survival reaction deep in our brain from old ages. Every time that we feel threatened, we will react with one of these options: fight, flight, fly, or faint. And this is not conscious. This is a reflex. So we need to evolve from this reaction. And this on daily basis can be just reduced by a blue screen. It's a survival mode. Only emergency and fundamental activities, survival activities, will work in this system. Does any one of you feel like you're in the survival mode in your current job? Because that's expected if you're not dealing well with communication in your organization. Most organizations don't deal well with that, and most people feel overwhelmed by information, by work, by jobs, or just complexity paralysis. He get paralyzed because he cannot deal with too much information, and the root cause of it is it's natural. But we have to understand about our behavior, because if we don't understand the way we behave, we'll be controlled by our own emotions. And this is the work about the leadership. So as leaders, we need to behave in ways that this reaction, the fight, fly, or faint, is not the standard. Because when you are reacting this way, there is no space for learning, no space for improvement, no space for creativity. There's no chance of effective problem solving because people are frightened, are afraid. And besides, we got several leaders that think they are good leaders. They are just using communication in a way that induces this kind of paralysis in their team. So most of the time, the system is not just working. We need to create environments not connected with this survival reflexes. We need to create environments that are psychological safe for us. That's one of the best responses for this kind of problem. And creating this kind of environment is not that easy, but some few recommendations. I think that everyone is talking about how we deal with leadership this 24 hours. But organizing the work as a learning problem is the solution. So we are problem solvers, and we must look to our organizations as a problem to be solved. It's not an execution problem. It's a problem set. Thinking about an A3 all of the time will introduce your organization to a better path in this complexity road. And we need to be honest. We will fail. So there is no perfection. We will fail most of the time because the system is moving from chaotic to coherent. So sometimes we will have chaotic results and the system will fail. We have to understand and recognize that sometimes failure has just to be accepted. But asking a lot of questions is the good part of it. When you fail, ask questions. Don't find responsibles. Find the questions about it. And then in the end, the changes in our organization is a destination, it's a journey, and it's an emotional connection. Without it, it does not happen. So the destination it's true north. You need to think about it. The journey is the way that you're doing, but the emotional connection must be created through leaders' behavior. So this emotional connection goes deeper on what we need to talk and understand and look after the way we communicate. I've been working with IHI for a while, and in 2019, we were invited to join a study group that were published like a white paper in 2021 with several organizations, actually 6 organizations. And 6 out of 6 of these organizations are well known for their lean culture. The Intermountain Healthcare, the Cleveland Clinic, East London NHS, so the Kaiser Permanente and Fairfield Healthcare are well-known organizations. And IOV, we've been practicing lean. At that point, I was still the CEO of IOV. We've been practicing lean for more than a decade as well. And what was the idea behind this approach thinking? It's how can we develop a responsive and resilient healthcare system? How can we develop and manage systems in organizations? And they created this idea behind the whole system quality, that it's a social technical system. It's not different from what we are used to see. It's based on management practices and leadership principles. And those practices, it's like a roadmap for creating this kind of organizations. So the first common, these are activities found in common in all of those organizations. So the 6 organizations in this study develop it in some different ways, but in the same structured base, these practices and these leadership principles. So, and that's what we've been doing long time ago in IOV, is developing our model themes and model processes and flows. We redesigned the quality team, and this is the idea behind the architect. It's the guardian of the system. It's not someone that is auditing the system. It's someone that is taking care of the system and nurturing the system and supporting the system. The third item is create a quality planning, a system, a rudimentary quality planning, putting customers first. Then a problem escalation system, and a learning system that goes from quality planning to quality improvement and quality control, connecting those dots. That is a perfect example of it, is daily management. So then leadership mentoring, that it's one of the activities related to the architect mindset. Those leadership mentoring activities are connected to leadership principles. This principles goes on building a shared sense of purpose, practice system thinking, and this is the idea behind the manifesto. Engage in collective learning and dialogue, so people are co-creating the process, co-creating activities, and do a personal inquiry and reflection. And this is the really, I would say, hard part of this process, because we are not quite used to reflect on what we are doing, and we are not inquiring ourselves about the way we are behaving, or the way that we are questioning people, or the way that we are introducing new tasks or new work to be done in our organization. And this created a lot of red flags and blue screens in the organization, even an unconscious way that we can make it there. And I will show you now a small example of what we've been doing during 2025 in a project together with the IHI. We put together lean thinking and improvement model in 11 emergency care units covering around 1.8 million inhabitants in the city of São Paulo, that it's the largest city in Brazil. And these emergency units are standalone units. They don't have a hospital behind, so every patient that got in these units have to be transferred to another hospital if they got complex cases to be solved. And we use the model of improving, trying to improve the experience of care and reduce avoidable deaths using mortality and time to refer and transfer, and news risk evaluation tool as a major metrics, using some visual management tools or connected help chain that it's a way that we use to connect the escalated huddles, and the 5 R's that are the theory of change, the theory of change, the 5 R's. It's an approach when we expect to recognize early some severe condition, apply the news, the risk score, and then rescue patient using bundles, and then reevaluate patients using news and the bundles, and then refer, transfer, and after that reflect about what's happening. The tools we use it. So it's the RN, it's news, the system that it's just vital signs that are associated with bad performance or clinical deterioration for those patients. Bundles and standard of care with visual management and like a safety cross or connecting the dots. We will show you. Connecting the dots is the way that we use to evaluate patients in a way that we can see how they are evolving through time. And so this is quite visual. When we get into yellow, it's a yellow sign, and we get to the red in vital signs. It's a real problem. And then with service level agreements for leaders doing catchball into tired huddles and problem solving for those patients. Our aim and our drivers in this activity is to engage leadership to create standardized leadership behaviors involving these 5 R's, and obviously an improvement plan for those activities at those organizations. And how we are doing at this point? Well, we started in March, and I got numbers from October here. The first step was create a daily huddle to deal with planning for quality control, and improvement. And we now have like a medium of 38 huddles per unit per week, which is around 4 to 5 huddles a day. That it's a lot of huddles happening, and they're adopting the huddles as well, and using these huddles to manage these R's, the bundles, the connect the dots, and the evaluation of those patients using news. And how they're doing about news. They're adopting, and they were able to adopt it in almost 98% of the organizations, and they are doing it for 98% of those patients involved. And I already show you what is the connecting the dots, and so 98% on these organizations now have the connected dots and are using for those. And what's about using indicators like huddles, like news, and connecting the dots? Well, when we are thinking about highly reliable organizations that are really reliable, that are resilient and responsive, we need to look for what we call leading indicators, indicators that will predict results, but not those indicators that are called lagging indicators. Is when you got an event. I said, oh, we got some 30 injuries in our organization. And this is a good example of a lagging indicator. The safety cross shows here when we got a safety event on the second day of the month, on 14th, on 18th, and on 19th. So this is lagging. We are just counting what went wrong. Here we are creating ways to predict if we are looking to the system, managing the system, and if we are adopting the right way to treat our patients. And this adoption reflects back to the adequate reevaluation of patients under sepsis risk. So now 83% of those patients are quite clearly evaluated and are getting the appropriate treatment, as well as those patients under cardiac arrest. It's not really good at this point. It's just 74%, but came out from 55%. So in those emergency departments, only 56% got real adequate cardiac arrest evaluation during their time in the emergency department. Now 74. For sepsis now is 98, over 90%. So it's good. So that's the idea behind creating a leading indicator, because we are trying to prevent something bad to happen to our patient. We are trying to prevent safety events or never events or sentinel events, whatever we can name it. The idea behind the architect is someone that is managing this system. He's scaffolding this system. So can be anyone, can be a leader, whatever. But this person will plan, co-create, and execute a temporary structure for training, for developing people, for creating the environment, then create a permanent structure based on daily management, and those items like a model line, a scaffolding, quality system, tired huddles, training and mentoring, and guiding teams as a guardian of the management system. The idea is that this person, this team, will mentor, support, and guide people, leaders, teams in the organization, using Deming's profound knowledge principles to manage those systems. Because we know that systems will decay. Systems will decay without a guardian. It's entropy. It's a natural law common to us all. So that's the idea behind the architect. And it's time for Q&A, Paloma.
Thank you very much, Dr. Fred. Congratulations for the project that you presented for us. We have one question here, an attendee that sent for us. In your opinion, a lean management system is a system of communication? Is a lean management system a
It's a
communication
great question
system?
because I think yes, it is. It's about communication. All systems are about communication. Our immune system is a complex system. It's deeply dependent on communication. And if you look, we sometimes we cannot see the way we communicate. We can see it's not clear, it's not visible, but all of them are. And what we are doing when we are creating value stream maps and co-creating a system is communicating to each other and putting together, getting the same information in the same, creating the same background. When you do like daily huddles, we're just communicating about what we need to do today, what we've done yesterday, and what's happening in our organization. So perfect. Yeah, I think that's right. And when we are trying to solve problems using an A3, this is basically a work of communication between two or more people.
Yeah, and I will connect it with this question. In your opinion, on your experience, what would be the first practical and measurable step of an organization that can start this system?
Yeah, we've been trying this for a while, since 2020, and we learned that starting earlier as possible daily management huddles, I think, are the best tools to improve communication in organizations. And some organizations that we started doing that didn't grew up their management system, keep doing daily huddles all the way through. They found the value of it, and they found it a great way to communicate and to manage the system. Besides, they're not managing everything. They're not focused on quality improvement. They're not running E3s. They keep doing huddles because it helps them to deal with problems, help them to communicate. Obviously, they would be doing much better if they got the whole system working together to quality improvement, quality management, and quality planning. But that's life.
Yeah. And what is the role of the leader in a company that would like to implement a huddle, implement this communication? What is the role of the leader?
I think he's a mentor. He work like asking questions and dealing with problems. And as Amy Edmondson said, it's not an execution problem, it's a learning problem. So we are here to learn, and learning process will need mentors, and we will need a more experienced people to help us to go on that. So leadership is about mentoring.
And there is a difference between the leader and the architect in a company?
A little bit different, yes, because the architect also has to look for the system, have that big view, and manage it, sustain it, because it will decay. So it has to put their energy on what is not working well and reflect about it and go deeper. And he's also the architect. She can be also a mentor, but it's a different kind of leadership. It's a systems architect. It's managing the system and taking care of the system.
Thank you very much. Our time is enough.
It's gone, yeah.
Yeah.
Great, thank you so much. Thank you, Dr. Fred.